Thank you so much. And thanks everybody for attending today. Nice to see you all. So my name's Nina Garrett. I'm the CTO at Abingdon Health, and I'm going to be talking to you today around lateral flow innovation and outlining some of the advances in the technology that have happened in recent times. So just to give an introduction to us, Abingdon Health are dedicated lateral flow developers and manufacturers. And our mission as a company is to improve life by making, I've gone too far, sorry. Improve life by making rapid tests accessible to all. We're headquartered in York, so not actual Abingdon, just to add a bit of conflict in there. And we've recently opened a new site in Wisconsin, USA, so we're actually expanding at the moment. We've been working in the lateral flow format since 2008. However, our team have got significant experience. Personally, I've been developing tests since 2001, and we're really proud to offer a comprehensive service where we can take ideas all the way from concept through to commercialization, making tests at scale, and even helping with regulatory services and distribution of the tests as well. So, thinking about innovation, it's probably a good idea to know where we've come from. So, lateral flow tests are not actually a new technology. The immunological test method started to be developed in the 1960s. It was, however, being able to take a pregnancy test at home in the late 1980s, where we really hit the first milestone for self-testing. The first tests were developed and launched under the Clearblue brand in 1988. And since those initial developments, the options for pregnancy testing have expanded significantly. You can tell not only if you're pregnant, yes or no, you can see how pregnant you are, you can have a digital readout, and all of this in under 3 minutes. So I think this is demonstrating that even a simple format can be seen to be really innovative, and you can innovate on something that is quite straightforward. So the next target of biomarker, I suppose, to think about when we're thinking of lateral flow, which we're far too familiar with, is COVID-19. The adoption of lateral flow testing and home testing for COVID really did bring down barriers to home testing and self-testing. And you can see from the chart that over 1.1 billion tests were taken in the US in 2021. So due to that amount of testing, innovation in the test format and investment into how to improve it has happened significantly over the last few years. And so it's not only the format, but also the end user that's being changed as well. It's not just a home self-pregnancy test or specific industries in food. We're seeing that the range of applications to which this technology can be applied is actually growing as well. So when we look at the different types of lateral flow tests that there are, how are we actually innovating is the question to answer. So they are a flexible technology. They can be used to determine the presence of a single biomarker, so when you're thinking about HCG for pregnancy test or COVID, but you can actually multiplex onto the test as well and test for several biomarkers at the same time. You can get COVID, flu, AB combinations, so being able to test for more than one biomarker is a reality, and they're actually on the market. They can be used to give a qualitative yes-no result, so a really simple end-user result, or they can be made more quantitative, where you can actually get a how-much result. And you can do that with application of reader units, but that's useful for the end-user to be able to track or monitor over time a certain condition or biomarker. One of the examples that we're starting to see more and more of is starting to use saliva as the sample matrices. So when you think about this, this is one of the improvements that you can see in innovations for the end user experience. Having to take a finger stick is not as convenient as being able to just put something into your mouth and getting a sample from it. Additionally, new particles are being used. The tests are being integrated with apps. I think mobile phones are becoming more and more significant in how the tests are being used. And finally, innovation is occurring around the presentation of the format, so how the cassette is actually presented. And I'll go into that in a little bit more detail in the following slides. So I'm not sure how much everybody knows about the integration of the reagents into a lateral flow test, but most of the tests that give you a red line is using a gold particle. So that particle is typically 40 nanometers, and that's conjugated to an antibody or biomarker that's going to detect the analyte that's in your sample. Different size particles can be used, and also different types of particles. So you've got latex or carbon, for example. An alternative method of interpreting the strip is also to use fluorescent particles. So this is where you don't actually get a visual signal. You will actually just get nothing there, but you can use a reader to look at the fluorescence level on the test strip. And that will then allow you to quantitate the results. So that's really important when you think about the end user. You're not actually going to have a test line, and you're going to need additional equipment, but you might see improvements around sensitivity if you're using these types of particles. The types of readers that are used with those tests can also be used with colorimetric tests, and overall you can get quantitative readings out of all of the particles that we work with, whether they're gold, latex, fluorescent, carbon. One of the key things that we're really keen on is that you're able to robustly manufacture all of these key reagents. So we innovate in our design processes when we're actually making the tests as well. I think it'd be remiss really when thinking back to that first slide and the figure that we brought out of 1.1 billion tests in America alone, not to consider the impact on the environment that the use of lateral flow tests is having. You can see from these statistics that there's a significant amount of plastic that's being used, and with the year-on-year growth of the rapid test format, the associated waste is also increasing. So we're working with third parties to actively change how the test format is presented. We're working with compostable lateral flow cassettes, and we're also working to replace the plastics that are included in the kits. If you think back to your COVID test, you had your tube, your swab, the plastic bag to dispose of it in. So we're looking at how we can replace all of those items to try and improve and make the testing as sustainable as possible. So smartphone readers, as I said, they're really coming to the forefront. Not only is the responsibility to interpret the test taken away from the end user, so you're removing the potential for someone not to see a line that's quite faint, but the results can also be shared and documented. They can also be made to actually read the test themselves, but also the end user can input the result of their test into the app. So both of these options allow data to be tracked and also shared and sent maybe directly to a laboratory or a doctor, cutting out having to then have the patient go and get the test themselves. They've already taken that test and shared the data, leading to a much more easy path to the right treatment. The technology itself is designed to be as portable as the phone in your pocket, and I think we all know that personalised tracking of data, how fitness apps are working, overall being able to check your own health and well-being, such as a ferritin test or vitamin D test, is just adding to people's ability to take control of their own well-being, really, and we're seeing that happening a lot more. So when it comes to the innovation that I've just talked through around sort of the particles, the different ways that the tests are presented, I'm now going to present some examples of some of the tests that are actually working with these innovative ways. So the first one I'll talk through is a company called Salignostics, and they've developed a test format which uses a saliva sample. This technology is easy to use and is designed to be a self-testing format. So why is that such a big deal? So saliva is one of the more challenging sample matrices to work with. As a developer, if you're working with something that's quite uniform, such as a blood sample or a plasma sample, then designing the test is actually a lot more straightforward. But when you're working with saliva, you've got to take into consideration quite a few considerations around the levels of biomarker. So you're looking at sort of picogram levels or something that might be in plasma at nanogram levels. Additionally, saliva itself has masking characteristics, which reduces the detectability of the biomarkers. They might get bound out. You've got mucins, for example. And additionally, there's inhibitory reagents which block the signal from actually developing at the test line. So overcoming these challenges is something that the test format that we see now has actually been developed to do. So the test allows the sample to be taken onto a swab into the mouth, and then that's actually screwed into the lateral flow test format, and that exudes the saliva into the test. The test format here also has a saliva collection option, so you're not actually running the test in this example here, you're actually collecting and uniformly providing that saliva sample for future testing. There are several lateral flow tests that are actually using this format, but they've actually developed one that's on sale at the moment for use with pregnancy. So I think back to the original statement that was a really key milestone in 1988 to be able to take a pregnancy test at home. What we're seeing now is that you're able to take a pregnancy test, but not in your bathroom at home. So for the ladies who've had to, hide away, lock the door and take the test, you can actually do that in an environment that you select. So just giving people the freedom of choice, really, to take a test when they want to. And with a different sample matrix, it's a lot more easy and to actually get. So another lateral flow test, which has also been designed with our customers, is a test for early diagnosis and detection of sepsis. I'm sure you're aware, and everybody in this conference is very aware around the importance of the detection of sepsis. The numbers that we have is that there are currently 50 million cases a year worldwide, and 11 million deaths globally as a result of this. So a company called Loop Diagnostics has developed a screening test for sepsis, which is easy to use, is affordable, and actually works with whole blood. So when you look at the actual workflow and how the test is completed, it's actually up to 10 times faster than existing methods. The test uses a blood sample, which is added to a reagent. That is then mixed, and the sample is then connected to the test strip. So you can see this is slightly different to a typical lateral flow test because you actually have a liquid reagent that you're pushing a test down to. So it's actually more of a vertical test that's being developed here. That test is then incubated for 2.5 hours in the reaction. And then after that time, you actually activate and press down to engage the test strip with the sample matrix itself. So as you can see, this is actually quite innovative in the way that you've got a sample incubation happening, and you're actually able to engage a lateral flow test with that whole processing method. So again, this is an example of how innovation in not only how the test is run, but how the end user interacts with the sample, because at the end you just get that yes/no test result. So the final case study I'll give around how lateral flow test is seeing advances is its crossover into the molecular diagnostics world. So incorporating the strengths of molecular technology, which is obviously a highly sensitive test, with a rapid test is really going to give you the best of both worlds. At Abingdon, we've designed a lateral flow test format that's designed to work with samples that are double labeled with either dig biotin or fan biotin. So if you're familiar with the type of PCR reactions that I'm talking about, this test strip will work with those. The overall process for how the test works and how the test is run is described here. So you take your sample, you complete an amplification reaction, and then you add an amount of that sample to a buffer, which is supplied with the test kit. Overall, that sample is then added to the test strip and is allowed to engage with the lateral flow test. The optimum read time for the test can be set as per a lab protocol, but overall, you're looking at about 10 to 15 minutes to be able to get a result. The result readout is really clear, as you can see from the device there. It's a really stark contrast with the nitrocellulose. We're actually using a carbon particle in this, so it's a black color instead of a red color, or blue as traditionally is seen. And the advantage of this here, which we touched on earlier, is that you can actually record the result and use that result to share to, for example, a central server or dashboard. And this allows really fast interpretation of data over different areas. This is useful in clinical settings, such as the pandemic, which we all know was using sort of different mobile phones to track and trace. But we see that it's really quite useful when you're looking at things like environmental testing, water quality. You can look at different areas in different industries. So overall, this PCRD test format is a flexible option that you can use with any type of amplification reaction, such as PCR, isothermal amplification, even with CRISPR. It's compatible with DNA, RNA, or probes. There are obviously some challenges to think about when you're looking at this type of test, making that front-end reaction of the amplification as friendly as possible for the end user. There's also heat considerations that have to be made. But overall, as long as you've got dig biotin or FITC fan biotin in that system, then it'll be suitable for use with the format that we have. So what are the key take-homes that we have around lateral flow tests? We know that the barriers to adoption were removed, mainly with COVID-19. and that these lateral flow tests are now being used in many different environments and different industries. The innovation that we've seen there is improving the access and the amount of end users that can actually use these tests. They can be used in simple test environments, such as pregnancy testing, but they can also be used with more complex systems, such as multiplexing with a number of different test lines, or with molecular devices, as we've just seen there. You can use these tests to record results, track and monitor, which is something that we're seeing a lot more of as people are developing apps which can link with doctors' units and different lab reporting systems. And I think in summary, we believe that flexible and accessible lateral flow options will really support our mission to improve making life better by making these rapid test solutions available to everybody. Overall, we're really proud to support and innovate ourselves and support our customers in the innovations that they make. So that's where I've got to with my presentation. Thank you for taking your time to listen. Are there any questions that anyone would like to ask?
Any questions?
Hi, thanks for that. I'm Darren Gates. I'm a paediatric intensive care consultant. Just wonder what you mean by sepsis with a yes or no, as it's a spectrum of conditions, really. What marker are you looking for, particularly, that says yes or no?
So there's a specific biomarker in the sample that is detected after the amplification mechanism. So they've identified TNF-alpha as a marker. That's our customers' technology that they've worked with.
Hello, thank you for a great presentation. My name is Maribel, founder of Simplex Molecular. I wonder what is the amplicon size, minimal size that you need for the lateral flow test to work?
We've used a range. We typically work with our customers and understand what you're using, and we can work with you on that. We've got some information back at our stand on G6, which I'd be happy to share with you around that. But yeah, we can give you a bit more information on that if you tell us a bit more about your reaction.
Any other questions? How does this lateral flow test different from points of care testing? Are there things that you can and can't test between the two different techniques?
No, it's just the environment of use and the way that the testing is designed at the end user. So you can have a self-test, you can have a point-of-care test, and you can have a professional use test in the lab. So there's no... The tests themselves, when you're developing them, you define the intended user, and that's how the test is developed and how that you validate that test for use in the environment of use.
Say INR testing, that's point-of-care testing, isn't it? Can you do lateral flow tests for testing INR?
Testing what, sorry? Iron?
INR, which is the thinness of your blood, international normalization ratio.
I'm sorry, no, we haven't got, well, I've not developed a test for that. What we're looking at is specific biomarkers. So, for example, we can test for something like ferritin, vitamin D. We have biomarkers around that. So basically anything that you can solubilize in a sample, we can develop a lateral flow test for.
And you work with other partners, don't you? So if anyone here has got any bright ideas...
Absolutely, and that's one of the things we were talking about at the stand. You know, we've got a lot of obviously healthcare professionals. If you can identify the gaps where, you know, you can improve the patient experience by being able to test more quickly, to give you information prior to coming to an appointment, that's, you know, a win-win for everybody in terms of time and resources, really.
Because one of our themes for this group is productivity, so that would help to improve productivity. Right, thank you.
No, thank you.